If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
But it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES, 243-3937 for more information.
Another happy May Saturday morning to everyone tuned in to VOB 92.9 FM. It's time for 15 of the healthiest 10th anniversary minutes you will hear on your radio. Hear me roll my tongue like Ronnie Clark. All with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and the Barbados Community Foundation. This is Peter the Boys here. If you are diabetic or pre-diabetic, don't you touch that dial, because you are listening to the right show at the right time. 15 minutes where you'll be hearing all about the Maria Holder Diabetes Center, located where?
Warren, St. Michael, behind you. Let's get some polyclinic.
You are so right. You would have won the lotto for the correct answer.
And what is winner doing today?
Today, we are focusing on your foots today. Or as some people might say, your feet. This will be a feet focus show. Because you know, when you are diabetic, your feet is something that you can't make no sport with. For example, what shoes are you wearing right now? If you're looking to go into town this morning, or you might be one of those people that's be standing up in long lines looking to buy T20 cricket tickets, once you are diabetic, you need to make sure that you're wearing the proper shoes. So this morning, our featured medical expert is going to be Dr. Diane Brathwaite. So she will be dealing with your feet and some other things too. So I know my neighbor Orlando and some other people will be saying,
I don't want to hear you, Peter Boys. I want to hear Dr. Brathwaite.
So ladies and gentlemen, Dr. Diane Brathwaite.
Hi, Dr. Brathwaite here again with you. I had an interesting client that we interviewed today. She allowed me to just record her just saying a few things about her journey with a foot ulceration.
I didn't know nothing about foot ulcers at first, but when I do find out, I guess it come from where I was working, the safety shoes, and I didn't know I was supposed to wear safety shoes like that. I called it carry seated toes shoes. So there I finally had it, but I didn't know. So when it did get bad, I've been to the doctor. When I get to the doctor told me I have to go straight to the hospital. When I get to the hospital, they're admitting me. So they'll monitor me, and then they come and tell me I have to get the tooth off because the foot infected. I tell her, okay. Then they claim now that the blood wasn't flowing to the foot. So you eventually have to get the foot amputated from a little above the ankle. I told her, no, I don't want it. A girlfriend of mine come and look for me. She tell me, after my discharge, she gonna release me and carry me to a herbalist. I've been from there, but when I get discharged, she sent me to the clinic in St. John. There wasn't doing nothing, it's in the progress. So I was between the clinic and my herbalist. So then a girlfriend didn't see me at church. She told me about this clinic here, down here. She make an appointment for me, and I come to see Dr. Brathwaite, and it went from there. It's going a year now I was here, and it get real progress. Right now, I would admit anybody to come here. These people here is very nice. It works for me. It works for anybody. They saved my feet, and I'm proud of it. The honest truth. And I thank them very much for what I see. And it will continue to eventually I get better.
But I think the important things to learn about this are what you wear on your feet matters. The main reasons that we see people presenting with bruises and calluses and ulcers in our clinic is actually incorrect footwear, also followed by callus and high pressure areas that are not properly managed. I want to just highlight some main points, however, in relationship to foot care. Number one, if you have diabetes and you notice a significant change in your feet, or you have a bruise, a problem with your nail or ulcer, please seek medical attention. If you have a puncture wound, you have to understand that puncture wounds are actually what we consider diabetic urgencies, meaning that they have to be seen quite quickly. A puncture wound actually introduces dirt deeper down into the flesh or the tissue of the foot. The foot is very complex in structure. There are multiple compartments. So if that puncture, say with a nail or a tap, introduces dirt or bacteria into a compartment, an infection can be set up and it can get out of hand very quickly, especially if your blood sugar is uncontrolled, and sometimes you don't realize how serious that infection is until it turns up on the outside. If the blood sugars are not controlled, the bacteria are going to get all happy on that sugar and they multiply extra fast. So please do not play with puncture wounds. Please present to a surgeon or to the hospital or get very good advice from your care provider on it. But puncture wounds actually need to be what we call debrided, or the tract needs to be taken out or excised, what we call like decorticated basically. Okay, don't mind the big words, that doesn't mean anything. But that puncture wound tract needs to be excised safely by somebody who's skilled at doing it, and they can make sure that they actually do it properly. If it's done but, unhealthy materials are left back in there, you could be setting yourself up for a lot of trouble. Always check your feet daily. If you can't see the bottom of your feet, tie a mirror onto something with a long handle. If you can't actually see your feet, get somebody else to look at it. When you're going to put on your shoes, shake your shoes out, make sure there are not rocks, stones, anything like that in there. And of course, wear the right footwear. So thin slippers, ballerina shoes, and other sandals where your foot is overhanging or not fitting are not going to protect your feet from an unexpected injury. And likewise, when you're dealing with diabetes, too big a shoe is not always a fit. Sometimes that will cause excessive shearing and the same injury that you're trying to avoid. But please listen to the words of the client, and I want to just remind people, don't take your feet into your own hands, because if you present too late, you may present at a stage where you have either overwhelming infection that can't be controlled, or you may have so much tissue loss that you may have to have significant amount of tissue removed from your foot, or you may even have a bone infection. That is something called osteomyelitis, which is very, very, very difficult to manage. And you really don't want to put yourself at risk of losing a digit or even having an amputation. Also, please manage things like your corns, calluses, and nail issues regularly. Don't let them get way out of hand and then present late for care.
As we continue our Foot Focus show this morning with Dr. Diane Brathwaite, we go to our Foot Focus song of the day. A song to make you get on your feet this Saturday morning. This is Mr. Blood with Me Foot on Fire. Compliments the Maria Holder Diabetes Center.
Always check your feet daily. Always check your feet daily. Don't take your feet into your own hands.
Look out for the Maria Holder Diabetes Center participating in the Rotary Clubs of Barbados Family Health Fair, which is on today, Saturday, the 11th of May at Golden Square Freedom Park in Bridgetown from 9 a.m. to 3 p.m. So you know tomorrow is Mother's Day, so you could take your mother to this event and make sure that she is good for tomorrow, because they're going to be having free health checks from Maria Holder Diabetes Center and other health entities as well. So take all the mothers and everybody to this special event today. And I want to say a happy Mother's Day to all the mothers in Barbados from the management and staff of the Diabetes Foundation, and also to my mommy, Colleen Boyce. If your feet is on fire, you need to take those feet to the Maria Holder Diabetes Center located in Warren St. Michael. Let me give you the number so you can call and make an appointment. Get signed and write it down. The number is 417-0305. That's to make an appointment or for general inquiries. But if you would like to get your eyes screened for diabetic retinopathy, that number is 243-3937. As we continue with the Maria Holder Diabetes Radio Show, Dr. Bradford, I told you to left. You got something else you want to say? Well, okay. So let us hear from Dr. Diane Bradford with some closing health tips.
I just once again want to remind you of some of the screening services we have. I love the phrase screen to save, and I honestly believe that's what screening can do. Get your pre-diabetes and diabetes screening very early. If you're at risk of diabetes or you have underlying conditions such as high blood pressure, cholesterol, ex-smoker, if you have diabetes that runs strongly in your family, especially if people had it at a younger age, or a parent your mom had diabetes in pregnancy, remember you need to be screened. So get advice on when you need to be screened. Everybody should be screened over the age of 35 years and under the age if you have certain risk factors, which mean that, maybe you need to get screened. Children are presenting with type 2 diabetes, so therefore discuss with your child's care provider if your child may need any form of screening or things that they may need that maybe you need to be concerned about with your child. Of course, we have our other screenings. Those would be our kidney screening tests, our foot screening, eye screening for that common condition called diabetic retinopathy, which is a major cause of visual loss and blindness in persons living with disease. And of course, our vascular screening, which screens for a reduction in flow of blood in the arteries. Something called PAD, or peripheral artery disease is the correct term. And persons who've had diabetes for an extended period of time, more than 10 years, or if you're over the age of 65, or if you have concomitant problems such as very poorly controlled blood pressure, high cholesterols, and certainly if you've been a smoker for an extended period of time, get advice as to whether you need to have that screening for PAD, and maybe our ABI test, which is the ankle breaker index test, may be of use to you. I'm wishing you a wonderful and blessed Saturday and weekend ahead. Remember, your health is your wealth. Do take good care of yourself. Thank you.
For over 10 years, the Maria Holder Diabetes Center has been effectively serving the diabetic and pre-diabetic community of Barbados with a range of international standard health services, which include diabetic eye screening, vascular screening, nutritional advice, and consultations with diabetes specialists. So if you are listening to VOB right now and you have a diabetic related query or you need to make an appointment, you can call 243-3937. You can also follow us on Facebook or Instagram. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program in partnership with the Barbados Community Foundation and the Maria Holder Diabetes Center, celebrating its 10th anniversary. Until next time,
drink more water. Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937.